Hello, everybody. It's Schizo, one of my conversations. I'm here with Dr. Gladney, also known as Dr. G. We're going to discuss sexual assault and the psychological effect it'll have, and how it commonly is, and how it's reported, not reported, and how it affects someone. It's good to have you here, Dr. G. If you could, tell us about yourself and stuff like that. It's my first interview, everybody. So I'm a little nervous, but Dr. G has been very, very kind to me concerning the interview and has helped me a lot. Go ahead.
Well, hello. Hello. I'm glad to be a part of your show.
Thank you.
And so thank you for having me.
It's a pleasure, and I really appreciate you coming on to discuss this. As you said and made it very clear to me, it's a heavy topic for a lot of people, and but it's something that I feel is very important to discuss, because it unfortunately, it's sexual assault is not a normal thing, but unfortunately is common, and there are a lot of victims, and I've realized that even more when I had saw a documentary called "I Am Evident" and how many um, rape kits that are not tested. I didn't realize there were that many. I thought maybe a couple of hundred because of backlog, but it turned out that it's hundreds of thousands for people, and the fact there are a lot of people right now, even now, that could be sitting at home terrified for whatever reason to even leave. And I just think it's very important that we discuss the type of things that are going through and go ahead. Sorry.
Okay. Well,
Uh,
yeah, before we get started, why don't I just kind of tell everybody in the
yeah,
audience,
go ahead.
because this is a really heavy topic. And
Mhm.
so, when in discussing this, I am Dr. Gladney, better known as Dr. G, and I have been in the field of psychology for over 25 years now. And so I've been talking and speaking about wellness for over 30 years, but actually became a doctor over 25 years ago. And so, with that, I have seen a lot. I have talked to thousands of people. I have been a part of a lot of people's journey. And unfortunately, in our society, it's been since the beginning of time that this topic is not a new topic, is not talked about as much as it should be. I am grateful for the TV program that you were talking about, which is the Special Victims Unit,
Yeah, yeah, yeah,
SVU, on Law and Order. It is now in its 25th season.
yes.
So that means for 25 years it has been in our faces directly for the people who want to see the show. Apparently, it does a really good job. It wouldn't be going on for 25 years.
Yeah,
So
yeah.
I'm grateful for that because that helps us to have the conversations
Hmm.
that should be had around this topic. I commend you, first of all, for wanting to talk about this. So, why don't you tell me, Schizo, why this is a topic that you felt that you should talk about when I see that most of your episodes have been about NFL and lighthearted stuff and sports that have absolutely nothing to do with this topic. So
Well,
why is it that this topic is important to you?
I've known people that have had either been molested or sexually assaulted, and then seeing that documentary, how bad it really is with the backlogs for hundreds of thousands. So knowing that, and I understand. I went through stuff when I was a kid, nothing like that with any sexual assault or anything like that, but I understand how it is to be fearful or afraid or scared, not knowing what's going to happen next, stuff like that. So I understand that concept of fear and wonder, and it's a lot different compared to sexual assault, wondering about rape kits, when it's going to come back, when are you going to know who did it, when they're going to find the person who did it to you. But I understand the fear, and I've known people, and I've seen people change over time when it has happened. They've even explained to me how they felt differently after. They didn't feel so safe. They didn't feel as calm. They didn't feel that things mattered anymore, or they changed their personality to where um, they were afraid of it happening again. So they became more promiscuous, so because they were afraid of it happening again. So I've talked to people on and off throughout my life, not I didn't go up to them and say, "Hey, have you been?" But sometimes it's come up because I've known them for a while or anything like that. So, hearing those stories, it showed me how much and how important, how much it happens, and how much it's not reported, how much it is reported and nothing happens, and how effect it can have on somebody for the rest of their life. Whether it's one, it could be anywhere from just 30 seconds to a minute or even longer, depending, just for the moment it happens, the moment they're grabbed, or it just has such a devastating psychological effect from the moment they're just grabbed. It's just, if that makes any sense. I'm not sure if that does, but it's just
Okay.
hearing that has been good. So
Yeah, so let's put some definition to some things
yeah.
because, first of all, this is sexual assault, rape, all of that. Research tells us it's about 1 in 5 women.
Hmm.
And this is national stats that, we're not talking worldwide because that's a whole different ball game because women are not viewed as people in some cultures. So
Yeah,
they don't
that's
keep
yeah.
stats on that. But we do here in America. And so in looking at this, I want to make sure people understand the definitions as we begin,
Hmm.
because sexual assault, sexual molestation, rape, all of those are kind of in a category. It's all assault and then sexual
Yeah,
harassment.
yeah,
So we've heard a
yeah.
lot about sexual harassment, whereas that's something that somebody's harassing you, whether it's through their looks, whether through it's something that they're saying, whether it's their behavior, meaning that their behavior without touching you,
Hmm.
that is considered harassment. Assault is actually when somebody puts their hand on you in some kind of way and they're touching you, grabbing you, assaulting you in your
Yeah.
body. And then obviously, then we have rape. And we know what rape is, but people still get it all confused. So, rape, there's levels. Rape is anywhere from the violent when you're walking down the street and some stranger grabs you and then, they rape you, assault you, um, all the way to where it's really difficult and where a lot of people do not report it because a lot of times it's somebody that you know. And when a woman says no or stop
Hmm.
and it's pursued, then it is considered rape. Those are the most difficult to prosecute, to report, to anything else because you know the person. You know, a woman tends to blame herself because, well, I shouldn't have been in that situation. I shouldn't have been in the room at the time. I shouldn't have been, I should not have been. So a lot of time the woman does blame herself and society does the victim blaming. Well, you should have known. Well, did you arouse him? Well, did this? Did you say yes? Did you kiss? It's all of these
Yeah,
conversations
yeah, yeah.
that then a woman says, I'm not going to report this because this is my fault. Then you have where it's maybe a mild acquaintance or somebody that you really don't know that has been, they may have been harassing you in the beginning and then they, decided, well, like, I'm going to come and get what I want. And so again, it's still difficult to report for women. And then, like I said, to the level of it's been a stranger, and typically that's not the typical one, because then, of course, then it's a rape, and they want to catch them because somebody broke in your house, and so typically they're the serial rapists and they're just raping women. So yeah, it's a really heavy duty topic, and it does go on, unfortunately, in our society every single day. And so there are behaviors and psychological behaviors now that we have to deal with when it comes to the victim and the predator.
Yeah.
So in our society, you are supposed to be innocent until proven guilty. That doesn't always work all the time on a lot of things, and particularly when it comes to any type of sexual assault. Sexual molestation is what happens, is what is generally defined when it is younger children and they are molested. And a lot of times they are assaulted, but we call it molested
Yeah. Why?
because
Oh, sorry. Why is it molestation rather than just a sexual assault? Why is the the word molestation used considered just sexual assault?
because when it is a younger victim, then it's you know it's not generally a violent.
Okay.
When you think of assault, and people get arrested for assault all the time, men could be assaulting each other because they're fighting.
Yeah. Okay.
So assault is generally the violence. Molestation is generally with somebody that the child knows, they've been primed, and so it is this
Okay.
nonviolent
Okay.
touching,
Okay.
nonviolent assaulting. A lot of times, the when it's the children, it doesn't always, have to be intercourse or anything like that, but they've been molested, they've touched, they've had to touch somebody, etc. So yeah, it is. It's just all in the semantics of what's happening. So all of that leads to a lot of different ways. So there's a lot of different ways to spin off from all of this. But it is something that we continue to need to talk about because it continued to happen. Unfortunately, in our society, rapists are not penalized to enough point that it stops it or that it makes people afraid, because guys continue to do it every day. And so,
Yeah.
yeah.
Yeah. Yeah. And sometimes they get off for some reason for any technicality, even though there's evidence and all this other stuff. It's unbelievable where. And have you dealt with situations when you have had patients where unfortunately there was just no evidence for some reason, and they have to deal like people having to deal with there not being any evidence for some odd reason? Is that harder? Have you noticed, has it been harder for sexual assault victims when for some reason they just can't find any evidence? Is that harder, or is it not? Or what I mean by harder is, do they feel less of a chance, of course, of the person getting caught compared to where there's evidence? Is there a different effect on them? Do you get what I'm trying to say?
Well, I think because when you go and report a rape, then a rape kit has to be done. So you have to
Yeah.
go to the hospital. That itself is very intrusive. And typically the victims feel like they are being violated all over again
Okay.
because of what that entails. At the end of the day, when you say there's no evidence, because like you stated in the beginning, there are hundreds of thousands
Yeah.
of rape
Yeah.
kits that are sitting there. So we can't even, it's not really about the evidence, it's about what is
Okay.
happening. A lot of women don't report it, and they share it with me as, in confidence of
Yep.
something that happened to them, maybe a few years ago or whatever, but it affects their life and it changes the trajectory of their life. So I'm helping them to heal through that, regardless of evidence, regardless of reporting, because most people don't want to go to court because it's this
Yeah.
whole process that takes years to get through the court system and all of that. And with the pandemic, everything got backed up. There's still backlog trying to catch up on
Yeah.
stuff.
Yeah.
And rape
Yeah.
is not at the high level of priority. So yeah, it's not really about evidence.
Now,
The
do you
evidence is that
go ahead? Go ahead.
somebody the evidence is that somebody came to me to say, this is what I need healing for. This is what has set my life in this direction. This is what has set my life in this direction. And this is what I need healing for. 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 And this is what I need healing So I don't need evidence to
Yeah,
help
well,
me.
I understand that. What I meant in the way it's affecting them compared to having evidence for the police compared to evidence for you to help them. That's what
Yeah,
I'm.
yeah,
That's
I
what I'm.
think so. We need to make it very clear
Yeah,
that most of the people that are raped do not report it.
yeah,
So it's not about if you have evidence, if they're pursuing. That is a journey. They don't want to go through that. They don't want to feel violated. They don't. So most women don't report it. And typically on college campuses where it's just rampant, all the way up. It's just unless somebody comes into your home in the middle of the night and it's a violent assault, a lot of times that's not the direction that women go because they are, victimized over and over again when you report it. So again, it's really about just, women coming to say, I need to heal from this. This is
yeah.
this
I
is
get you. Yeah, because
traumatized my life.
if they're telling the story over and over again, it's just a constant because they're telling different people, so it's a constant like being assaulted all over again by talking about it. So when they talk to a prosecutor, then a cop, and they keep going, and in court, it's just for them, it's a constant. They're just reliving it constantly, and it's like
Yeah.
it's never stopping for them, especially throughout that process. So it's good that it's good that people have been able to go to you and you've been able to help them or try to, or they're trying, which is a good thing.
Yes.
It's unfortunate that it's happening as much as it is, especially on college campuses, which for some reason it seems it's been hidden a lot that I've noticed, because colleges are more concerned about how things look rather than the justice that person needs, and I've noticed that too. It's just to let something run rampant that is just so horrifying and lasts a lifetime, for psychologically for effect. It affects, whether or not they're gonna have friends. Like I said before, they could just be sitting at home forever, just terrified to do anything. And they gotta find someone to talk to, which is probably very difficult when it comes to a therapist because they gotta find someone they feel that they can trust, that believe them. And I did it a lot for any type of therapy. They got to feel like they're being believed, that they're going to listen, which they probably have to do a lot. I mean, in general aspect of therapy in general, for anyone over anything, you have to find someone you trust who will believe you, who will understand. So it's a lot to try to find because, you know, it could take a while before you find a therapist that will help you through any of that or feel like you're being helped through any of that. Have you noticed that yourself in
Well,
therapy in general?
no, people tend to know that as therapists we're going to believe them.
Okay.
It's just a matter of people finding the right person that they feel comfortable with. But you don't know
Hmm.
until you try.
Yeah, yeah, I know.
And
Yeah,
so
that
yeah,
well,
you have to try and make sure that you go. If you don't find that person and you go to the next person.
yeah,
But oftentimes people don't because in our society, therapy is not even looked at as something. And every single person walking on the face of this planet needs some therapy.
yeah, yeah. That is
Every
true.
person
That
needs therapy.
that yeah, that's
And,
true. That's true because
and
life.
most of us do not get therapy. So we all need therapy.
Yeah, yeah, we do. I mean, life is hard, no matter which way you go. I mean, you need therapy for so many things, and there's a stigma that the person's just crazy, no matter what they go for, that they're just crazy, and that's why they're going. When in reality,
Well, yeah,
they just
it's not.
want help.
Yeah, well, it's not so much the stigma anymore that they're crazy. It's not that because that's not even the vernacular that we use because
Okay, sorry.
now there's a great push of mental health and wellness, and so it is on every platform. The celebrities, everybody's talking about
Hmm.
therapy. Everybody can get a coach, a life coach. It's
That's
it's a
yeah,
softer way, but people are seeking help. So it's not that people feel like that it's that you have to be crazy you go so you don't go crazy. Okay. So I help people
Yeah.
stay sane in a crazy world. This world is crazy.
Yes, it is. It
So
is.
that's what's crazy. If you want to stay sane, then you have to go and get help. You got to
Yeah,
go
that's
and talk to somebody outside of yourself that can listen and help you kind of think through what your thoughts are and what's going on in your life.
because it could be very difficult to talk about anything. Um, any difficulty because for some people, there are people out there that are just they're afraid to show that they're having difficulty in anything at all when it comes to that. So for some people, it could be hard in just that aspect of talking about difficult things or something that did happen. Like we're talking about that situation or that um, when we're talking about sexual assault, that and there's other things that people have problems with talking about because they think even if it's not something about sexual assault, just in general, they feel that it shows that they're weak. Even though mental health is being talked about more and more when it comes to celebrities and all that stuff, there's still people out there that feel that if they go and talk to someone, that it means they're weak or they're you know they can't handle life. When in reality, the reason why they're talking to somebody is because they've handled life up until this point, but there's something going on. They just need help with it. They can handle life. It's just life has gotten a little too much and they're trying to figure out a better way to handle it, a better way to do, whether it's talking about it, medication, they want to just get to the next step past whatever's bothering them so they can continue. Because if something's bothered them for way too long, they're not going to go forward at all. They're going to stay exactly where they are and they're going to be terrified to go further. But therapy is very important because it could help a lot of people just move past something, figure out how to handle it. I mean, there's different exercises that people can do that I've heard of. So when it comes to just talk to family, talk to a therapist like yourself, psychiatrist, therapist. Is it just interchangeable or
No, not at all.
okay? What
I'm a psychologist.
a psychologist?
So
Okay,
a psychologist, it really focuses on human behavior and and the mind, and we help
okay,
people to get to the root of their problem without medicine. A psychiatrist is also a certified MD where they diagnose and prescribe medicine. A
okay,
therapist is somebody that is mainly counseling you.
okay, okay,
So you don't need a doctorate degree to have a therapist, to be a therapist. So yeah, so it's in a counselor I mean it's so many
okay, okay,
different um different ways to talk about mental health. However, each one of those are important. I do want to address what you said earlier when you said it's a sign of weakness. That's generally a male thing.
yeah,
Women don't feel like, oh well, I'm gonna be weak. We don't look at
yeah, no,
life
I know, I
in
know,
strength and weakness. Um, but men will sometimes have that thought, well, I'm a man, I can deal with it, I'm strong, I was taught to be all that. So that
yeah,
really is
yeah,
something coming from the male perspective that needs to be eliminated because men die earlier than women because of heart attacks and all the other stuff because you don't let the stuff out, you don't deal
yeah.
with it. So, just trying to get people more involved in the therapy. Hmm.
Have you noticed that it is so for you? You've noticed that it's more difficult for men and less difficult for women. So I'm guessing I don't know if you have the stat or I just thought about this right now. So I'm guessing the percentages are higher for women that seek therapy than men. I'm guessing.
Oh, absolutely. Absolutely. Even in what I've been doing for over 2 decades, 93% of my clients have been women,
Oh,
not
wow.
men. So, yeah,
Yeah.
men
Yeah.
typically don't come and ask for help.
Were you when you started therapy? Were you not therapy, psychology? Sorry, I'm gonna say it correctly. So, when you started doing psychology, were you surprised that there were mostly women? Did you expect more men, or did you
No, I
expect?
didn't because I've always known men, you're too young, but prior to us having GPS, men wouldn't even stop and ask for directions. They think they know and they just program that way.
Yeah,
So,
yeah,
I wasn't surprised. I've learned a whole lot about humans and human behavior and the human brain, and I know how the men's brain are wired, and I know how women's brains are wired. So no, not surprised at all that men feel like that they can handle it, and the society teaches men. And I have a son as well. We teach them to be strong and suck it up and be a man and don't cry and all the crap that we put out there in your head. Then of course it's gonna make it seem like, well, I can't share my emotions or my feelings, or that's a female thing, and I don't want to be a. There's so many words to put in there. So yeah,
Yeah. So
no, I
have you talked to your son that if there's ever an issue that it is okay to seek that
Oh,
it doesn't mean
absolutely. My son has
yeah.
been in counseling. Absolutely. I put him in counseling. I have 4 kids. I understand the importance of them talking to someone and therapy and all of that. Oh, absolutely. I don't it's just second nature here. Second
Well,
nature. Yeah.
well, it's good, it's good that you do that then, because it is true at any age anything can happen. And not saying only horrific things, but if there's something going on, they're having trouble, they're afraid to tell, not something horrible, but if they're having trouble with school, or you
Yeah.
know the work is too hard and they're afraid to say, this is kind of too hard for me, I'm going to need help. I mean, it's good that people are accepting therapy a lot more than they were. I mean, 30 years ago, therapy was probably, when you started, therapy was probably considered, what was therapy that you remember being considered? I can't find the word, but what to you that you heard when you got into it, what did you hear the most about what therapy was considered? Or not therapy, psychology, psychiatry, all that.
Well, it's all therapy.
Oh, it is
It's
all
just
therapy.
different levels, and we have different labels on what we do. The
Oh,
whole
okay.
point is we're all trying to make people's lives better. So it's just what you're called doing it.
Oh,
But
okay.
your question was, what did I hear it was said or
What
talked about?
Yeah, what did you what was said mostly concerning therapy
Well, it was just,
negatively
yeah,
when you got into it?
yeah, it was taboo, and it wasn't something that people wanted because again, it did have the negative labels that something was wrong with you, and nobody wants to feel like something's wrong with them. Nobody wants to be labeled that something is wrong with them. Throughout the decades, it's gotten better. Like I said, and even I think the pandemic, people all realized that everybody needed some help because everybody was suffering with depression and anxiety and losing loved ones, and there was a lot of stuff going on. So people really came to grips with their mental well-being. I think social media has helped people to realize that a lot happens on these platforms, and a lot of bullying, a lot of things that go on that are affecting people's mental well-being. So here in our society lately, we have understood and known that okay, this is important.
Yeah, yeah, yeah. Which I
Yeah,
never which was surprised me, even though um so what surprised me most is that the fact nobody understood that things are psychologically affecting people.
yeah,
I just never understood how they could sit there and think that if you do something or treat someone away or abuse them in any way as a child, why they wouldn't somehow have issues later on, whether it becomes, trusting someone or interacting with people. Because to think that it's not affecting them in any way, it just doesn't make any sense. Because everything affects somebody in every kind of way. It could be child abuse, it could be a loved one dying, it could be your kids dying, you know what I mean? It could be anything, but to think that it's not psychologically affecting them, it just never made sense to me, because everything is psychologically effective, you know.
it is. You're
It's
so right.
yeah, because I've been through a lot going back to when I was a kid, starting very young, so I understood years ago how bad things can psychologically affect you, and it can last. Some of it will last forever, no matter what it is. It'll
Absolutely.
always be there. That thing you could talk about it, but unfortunately, specific things will last forever. Unfortunately, It's
Well, we try to give people strategies and everything so that it doesn't last forever. The memory may be there,
yeah,
but there's ways to heal and to be able to, I guess, make sure that you stay in control of your well-being and your experiences and memories don't take charge of your life.
yeah,
So yeah, there's some things now that are going to be harder to do to get past, and rape is one of those that as we
yeah,
started, the conversation.
yeah,
But there are a lot of women that they become victorious over and not a victim. And so they become advocates and put that energy into a positive space. So it just kind of all it all we try to make it come together for the betterment of them, even though something bad has happened. Then, as in our world, we really, really want everybody to heal. We want
yeah.
everybody to have strategies that will help them to move forward in a
Are
better.
are are there strategies more tougher than others when it comes to stuff like that? Do you understand what I mean? Like, is there when you do strategies for stuff like that, strategy stuff like that, do you is some more difficult for than other strategies for um anybody seeking therapy? Are some better for others compared to others when it comes to strategies?
Well, it just kind of depends on what they've been through. And
Okay, gotcha.
that depends on, what steps that we give to help with the healing process, to help with everything. So, yeah, there's going to be, depending on the trauma. Everything is about trauma and what's been experienced. So, yeah, there's going to be some that are more difficult than others
Okay.
to do. Some things take a little bit longer time to heal from, um, depending again on the severity of the trauma. But you can't measure rape as rape.
Yeah.
It's the betrayal of somebody that you know that raped you can be harder, can be a little bit more difficult to deal with because you never would have thought that person would have done whatever than somebody, you know, that you don't know. So it's so many variables when it comes to this. It's not anything that you just go, okay, here's how it works. So people are different, have different emotions, different feelings, different ways that is manifested through their behavior. So yeah, it's a lot. It's a
Yeah, it
lot.
is. It is. It is. Especially with that,
Yeah.
with rape and sexual assault, is a lot to go through. And from what I've talked to people, like I said, that I know that have been or anything like that, it's very clear. I mean, it was clear years ago, but hearing it in front of you, I've heard it years ago. But hearing it in front of you and being told face to face with someone it shows you even more how much and effective it is when you actually see it playing out in front of you.
Yes.
Not the act, but you know what I mean, the psychological effect and the changes. So
Absolutely.
it is. It is.
Absolutely.
It's so and
Yeah. Yeah. So
uh
as we wrap up, I just want to
yeah.
encourage you, if there are any listeners out there that have been assaulted, that have been raped, I definitely encourage you to seek counseling, to even if it's something that was not reported, there's a healing journey and we can help you with that. And so always I want people to know that there's safety when you come to us, and we have dedicated our lives into helping other people to have a better life. So the healing process begins when you can seek outside help. It's not your family. Your family know how to be supportive and everything, but they have not been trained to know the right things to do, to say, to help you get to a different space. And so I can be contacted through my website, Dr. Gladney, that's drgladney.com. drgladney.com. You can reach me there. I'm on all social media platforms, Facebook, Dr. Gladney, LinkedIn, Dr. Gladney, Instagram, Dr. Gladney, TikTok, Dr. Gladney. I am out there. So if you need to reach me, that's how you can get to me. If you have any questions or guidance, need help, or need need to start your healing journey.
Yeah, I'm very thankful for you coming on today, Dr. G, and discussing this and the heavy discussion when it comes to that subject. And you've explained to me how heavy it is. Like I said from the beginning, at the beginning of the show, you explained that to me even more. And I do appreciate you coming on, and and I really do. Being my first interview, my first guest, I really do thank you.
Absolutely. Thank you for having me.
All right,
And I can help somebody to have a better life.
all right, thank you.
Thank you so much.